Joy?
Oh yeah,
Joy,
it's working.
Is it
can you hear
working?
me?
Yeah, it's working. Did you record?
Show my screen.
Good, Joy. It's recording. I heard it.
Yeah,
Is it
it's
recording?
recording.
Okay, thank you.
All right, so on my case, a 16-year-old girl was extremely smart. She was the best student in her class. A few months ago, her family noticed that she dropped out of school, started talking to herself a lot. Her moods became very paranoid. Her behavior changed, and so did the way her 5 senses work.
Schizophrenia.
Yes,
Thank you very much.
good job. Good job,
All right.
Sarah.
Thank you.
That was fast.
Darlington, please, can you treat, give us the diagnosis procedure? Why Stella will give us the treatment?
Okay, so are you able to hear me?
Yeah,
Yes.
we hear you.
Okay, so for the diagnostic procedure, we have to do a family history exam, and we can do a CT scan, an MRE, a PET, or a psychiatric evaluation. So that's how we diagnose.
Yep.
All right, thank you very much. Stella, please, can you give us the treatment?
Yeah, so the treatment would be that they can take medication for it, and also it would be like just like counseling and medication. Let's see what else this says. Yeah, it's basically medication is what you need.
Yeah.
All right, thank you very much. In that medication treatment, yeah, they're asking them to give the person omega-3 fatty acid. Also there, feedback analyzations is also there. You get that? I want to ask a question in this very particular sickness. Have you come across who have such illness? Have any one of you come across who have such illness?
As what?
This particular disease we are treating, have anybody come that is one-on-one, meet someone who has it, or observe who has it around he or her?
Of any of the diseases?
Yeah, this particular disease we are treating.
So are you asking if anybody we know has had schizophrenia or?
Yes, that is what I'm asking.
I know.
My uncle had schizophrenia.
Okay.
He committed suicide.
You committed
Wow.
suicide.
Mhm.
Wow.
Yeah, because when I was reading about this disease, is most of them they have voices. Everything, the 5 senses is telling them how to kill themselves, like they're not good enough, and there's always constantly voices telling them to hurt themselves.
Yeah, with my uncle, it was more, he never said that he heard voices or anything. He could have, and maybe didn't say, or we don't know, but
Yeah.
because I was talking, I started talking to my mom when I was learning about schizophrenia, and I was like, Uncle Raymond had schizophrenia, didn't he? And she was like, yeah. And she told me he was diagnosed with it, but he never took the medicine. And his own dad didn't think that he had it. But she then told me he was also bulimic. And when he would eat food, like he would say that he could like feel like the molecules and of the food, and it like he couldn't stand it. And so then I was like, you know what, that is a sensory
another
issue.
one.
Yeah, like that's a sensory issue that is associated or can be associated with schizophrenia. So I think his diagnosis was bulim what's
Bulimia.
it was like bulimia, schizophrenia. And his
Yeah.
was more his schizophrenia was like the paranoid one, where he just was like always thinking that somebody was out to get him.
Yeah.
Wow.
And if they weren't educated like early, and then that's when if they didn't get it early, he didn't took medicine for it, that's when most of them don't make it.
Yeah. So he died in his early 20s.
Oh, so
Wow.
young. Yeah, most of them were super young when I was reading the stories.
Yeah.
Wow. Well, I didn't ask this question because when I read it, I was just afraid, like say, I never knew that voice can be, that is some voice, you'll be hearing so many voice, like 4 voice at once in your ear. One will be telling you to do one wrong thing or the other, that kind of thing. And this
Yeah.
really matters when you are in a family, at least when they say examine your family history. It's very, very important.
That's why I was like, Mom, that's our family. Like, this is freaking me out. And so, and she said, because I was like, well, did he hear voices, or did he have like evil thoughts and voices telling him to do evil things? And she said, no, like he wouldn't have hurt a fly. Like he was like the nicest, the sweetest to all animals and people. But
Wow.
so like, then I was like, well, then it's not schizophrenia then, But then when she told me about the bulimia and that he was paranoid and stuff, then I'm like, well, maybe it was schizophrenia. But there's also like paranoia with personality disorder, where you think
Right.
people are out to get you. So I think maybe it is schizophrenia, just because the doctor diagnosed him as that, but we don't know. He would never had like evil thoughts. He committed suicide, but he was severely depressed and lonely.
That could be from depression. Yeah.
And he was drinking and stuff because he was so sad and depressed. So I don't think he killed himself because a voice told him to.
Mhm.
Maybe so, and he never told anybody because it was embarrassing to him. I don't know, because we never know. We never knew that.
I just feel like what really happened to him is that he was embarrassed to say that such a thing. He looked crazy, he looked stupid.
Yeah. It's very possible that
Yes,
he was embarrassed.
somebody is telling me something. So it's very, very important that you watch closely to your family, especially when they are growing young. Very, very important. Watch them closely. Then you
Yeah.
get the part and start working on the person immediately. Thank you very much for that wonderful thing. This is the choose to work on. Thank you. I'm so happy with you. So the second person, who again is going to give us his case study.
Who's next?
Who's next to give us his case study? Or
I can do Molly's.
Okay, you promised Maurice that you will do her own. Go ahead and do Maurice. So let's see what happened there.
Okay. A 25-year-old male visits the health facility with complaints of excessive worry, trembling, shaking, and shortness of breath. A health personnel inquires from him if he was attacked by bandits to have so much fear. He said that he was not attacked by anyone at all, but the symptoms started on their own and didn't know what could be causing all this. He said he had been experiencing these symptoms for the past 6 months. He also said that sometimes he experiences tingling, chills, and hot flashes.
So what is the sickness?
It sounds like anxiety, like stress, anxiety.
That's what it is, anxiety disorder.
That is what I'm thinking.
It sounds like it. If it's sick, all the symptoms.
I'm also thinking about it because of the chilling and hot flash.
Yeah.
All right, maybe I will do the description, then Darlington will do the treatment. Darren, are you
Okay.
there? Okay. The diagnosis of it is, I don't think that this thing have a diagnosis, so they just went straight to the treatment.
She wrote finding out the history of illness.
Okay. Correction of the history of the illness.
Mhm.
Yeah.
Diagnosis procedure of it. Correction of the history of the illness. Darren, can you do the treatment for us?
Okay, for the treatment, it's a combination of medication, psychotherapy, or hypnotherapy.
Okay. You know, so that they say deep breath exercise.
Yeah.
Here as well. Then behavior therapy, which is CBT, is there as well.
And also the kava plant.
Yeah,
Yeah.
I was
And I
reading
was
that.
like, what the heck is that? So I Googled it. That was
You
pretty-
did?
Yeah. It's
When
a
I come across that plant, I was just thinking, I don't know what kind of plant.
Yeah, it's a crop from the Pacific Islands. The meaning of
Oh.
kava is bitter. And so I don't know. I guess it's used there, but the FDA has
Didn't
said
approve it?
they say that if it's taken in certain forms, it could actually affect your
Harm
health,
you.
like worse. Yeah. So
Oh.
I think it's supposed to be taken a certain way. Like you actually take the plant and warm it up, and like it has to be a certain way. But it makes you like calm and relaxed. And when I was reading about it, I'm like, so is it
Wow.
like a drug? Like
It sounds like marijuana or something like that.
Yeah, that's kind of what it was sounding like, but they didn't ever say that. They just said it. I don't know. That's what it sounds like.
But
But
because
anyway.
if they do too much, and then they'll be like
Yeah. So
Wow. Thank you very
flying
much.
everywhere.
Anthony, please, can you share your case study with us?
Okay,
Anthony,
yes, I'm here. Just a second. Okay, so my case study is interesting. I did not, I was unable to come up with a case study because it's quite difficult to come up with a case study for such a disorder. But I talk about these things almost every day because my work involves health education. So it's not something new. So just a sec, let me just close it. Okay, so here is a man who's married, and he's having challenges, sexual challenges. He's having challenges with having an erection in order for him to engage in sexual intercourse. So obviously that should explain the kind of disorder that this man is having. So I'll give a chance to anyone to share the diagnosis of the description and the diagnosis and the treatment.
all right, is that your case study?
Yes, that's my case study.
Are you talking about premature ejaculation?
No.
it's
Oh,
not
which one are you
premature
talking about?
ejaculation.
Yeah, that is what I'm thinking. Which is what exactly
No,
are you talking about?
It's
No,
male
it's
erectile
erectile
disorder.
disorder. Erectile disorder. Yeah.
Male erectile disorder.
Yeah.
Is what?
Yeah, yes, that's the disorder, yes.
Mm-hmm.
Is that what is
And
the name?
just male erectile disorder.
Okay, man.
Yes.
Okay. Okay. So who can give us the description and the treatment of such? Who can give us the treatment and the
I know the treatment is they can, well, So it depends why, like you have to kind of search around why this is happening. So I think there was a case study in the book that said that this particular one his wife had died. And so then he was having problems 2 years later. And so his was to go to counseling, you know, like that's something that he needs. Because that might be just grief issues that's causing him not to be able to do that. But if it's, you know, if there's nothing like traumatic that is going on in his life or high stress, then it could be, and maybe he's older in age, then he could use medication like Viagra and things like that.
Right.
Okay.
You said it perfect.
You just said it all. All right. The diagnosis is sexual history and physical examination, isn't it? And ultrasound. Am I correct? Am I correct in that procedure?
Let me see. The
Sexual history,
for
physical examination, ultrasound.
Yes,
yeah, the ultrasound and neurological examination.
Yeah, neurological examination. Wow, that is okay. And I believe that the etiology of it. Anxiety and depression is also the cause of low ejaculation in men. Is that clear? If you go to the etiology of it, you will see it there.
Yeah.
The causes of it. Find out that anxiety is also there and depression is also there. Feeling of independence and rejection can as well cause a man to, you know, have
Okay.
a yeah.
Maybe too, if they have like a illness and they don't know it, like a health condition, and it could be another cause until they find out later if that's why the reason why, if they were sick with something else.
Yeah, that is true. I agree with you on that. All right, thank you. I think I will share my case study right now.
Okay.
Let me see whether I can share. If I can share. Yeah. Okay. Can you see my screen?
Yeah.
Okay, my case study is a whole long story. You know? Okay,
It's because you're recording. That happened to me when I was doing the Zoom recording. My computer was very slow after.
Okay. Can someone see it?
Yeah.
Yeah.
Okay, I'll make it bigger. Sorry. Okay, this is my case study. Ray is a 9 years old who withdrew from college after experiencing a marquee episode during which he was brought to the attention of the campus policy. I took the personality to pull multiple fire alarms in my drum to ensure that they worked. Given the life and or death nature of fire, he had changed his major from engineer to philosophy and he increasingly had reduced his sleep, spent long hours engaging his friend in conversation about the nature of reality. He had been convinced about the importance of his idea, stating frequently that he was more learned and advanced than all his prophets. He told others that he was on the verge of liberation his new field, and he grew increasingly irritable and tolerant of any who disagree with him. He also increased a number of high-risk behaviors, drinking and engaging in sexual relations in a way that was unlikely his previous history. Ray's parents acknowledged that he had any problem with anxiety during the adolescence by some period of withdrawing and depression during his adolescence. What is my case study?
It sounds like bipolar,
Yeah.
right?
Exactly. Yes.
When it says about the sexual part in
Reason
the
of
angry, like maniac, doing good and then crashing.
Yes, that is it. All right.
That was a good case study. You did very well.
Dandy will be doing the treatment while Brother Anthony will be doing the diagnostic procedure of it.
Sorry, did you mention my name?
Yes, I mentioned your name, Brother Anthony. You will be doing
What?
the diagnostic procedure while Andy will do the treatment.
Oh, okay. So for the diagnostic procedures, you look at the alternating mania and depression. Okay, so maybe just before I go into details with the diagnostic procedures, there was in the beginning of this document, there was that part where it says, let me just get to it. It says mental status examination. If I understand that correctly, that's how you kind of examine a person and to be able to determine what's going on, right?
Mm-hmm.
Yeah.
Oh, okay. All right. I just wanted to understand that I'm on the same page. Yeah. So
It
you
says
basically.
it's mental exam,
Mhm.
mental examination.
Yeah, it highlights a few things that talks about where is that? Yeah, it talks about looking at the appearance of the person, the speech, the motor activity, the mood. Yeah. Okay, so I just wanted to.
That and the mental examination, I know that like there are actually tests and stuff that you take in mental health where so like when it says mental examination, it's like there's questionnaires, they ask you a bunch of questions, or it's like on the computer, and you do like certain things that you answer certain questions, or like, so my son did it for ADHD, and when they do like the testing for ADHD, they give you like a bunch of questionnaires. I mean, depending on your doctor and depending on your age and all that stuff, but there's also like things that you look at on a computer and you're like pressing buttons and see how fast you're responding to it. So those are all like, that's also ways that they diagnose mental health and know like what area you're struggling in, whether it's like intelligence or it's your focus, or if it's like they want to know like how spontaneous you are, like if you have like these manic phases, like can you multitask, do you stop doing one task and move to the other, like, so there's a bunch of questions, like 300 questions that they'll ask on these things to try to figure out your diagnosis. So I think when it says like mental examination, it's kind of meaning that it's like getting into depth of all these questions, and you actually just sit down and have to do these tests.
Yeah,
all right.
that's clear. Yeah. So yeah, like I said, on the diagnostic procedures, there's quite a lot of things there. There's maniac episodes which are dependent on abnormally elevated expressive or irritable mood lasting 1 week and 3 or more. So basically you can just you're able to tell the kind of mood the person is in. And when I was reading this, I kind of I don't know if you guys watch a lot of crime investigations. There is a common trend between people that murder others there's a common trend of some form of what am I trying to say? Like there's it's like they're in the same mental status, like people that kill other people, they end up being diagnosed with the same thing or something close to, similar to the other person. So that's what came into my mind. So there's a lot of other things you can look at: decreased sleep, some talkativeness, and engagement in pleasurable activities. So I think this also relates to the sexual part where somebody, let me not go into details with that. So I think, that's how it's diagnosed.
Okay, treatment.
Am I talking about the treatment too?
No, Sister Angie, we talk about that.
Oh, so it's me. Hello?
Yes.
Okay, so for the treatment, it's still, you still can do psychotherapy, you can do ECT, you can, this is to try to decrease the frequency of the episodes, like the mania and depression episodes. You can also screen for suicidal, destructive or criminal thoughts. So you can find out if that person is having suicidal or criminal thoughts and then try to calm them down or something.
Okay. This one, I need a little question about it. I don't know, somebody who is not a criminal before, based on this sickness now, he can have a criminal thought or what?
Or not? What'd you say?
I am asking a question on it. I say, when it comes to the treatment of this, it screened the suicide and destructive of criminal thoughts.
Or criminal thought?
As soon as the person, I mean, is it that as soon as the person develops the sickness, he develops to think about to steal or give a criminal thought or something?
So
like
I know 2 people close to me have bipolar disorder, and I wouldn't say that they have any criminal thoughts, like that they want to steal or they want to do things like that. They seem like just a normal person, like you, unless you were really close to them, you might never know. So it maybe only close friends and family members would ever be able to be like, okay, they have bipolar disorder, because it's like they act like, super energetic, like let's get this, like, but they have like these big dreams and big goals, which a lot of people do, but sometimes they're just not reality. Like it's like, I want to become president of the United States, blah blah. It's just like that's never gonna probably happen, but that's a good goal, But then they stay on this high where that's manic, where they're up here and they're just go go go, and then the next thing you know, they're way low and they're just depressed. They don't leave their room. They just sleep for all day. It's like depression, so you have like this hyper manic, and then, and that can go on for weeks. And then their depression, then, the low comes in, and they don't necessarily get criminal thoughts or anything. I think if it was criminal thoughts, it might be on their manic, where they kind of just lose all sense of reality. And when they're on their low, they are more suicidal. Like they're severely depressed. They don't ever see themselves coming out of it. They think it's, they have no hope. It's just like severe depression. And that
you said it's so perfect.
That is just said it right. Why I ask this question is that in where I was living, there's one young some boy like that, very quiet and very respectful like that. On a beautiful like day, I was just coming back from work and I see people gathered around him, beating him. I say, what matter of this guy do that the warrant of beating groupie like this? They say he's still. They steal what? He said they say he steal someone's chicken. I was like, this cannot be. How? How does it happen? when we start asking, he say he doesn't know. He doesn't know how it comes up. Like, you understand, after we matter the this thing for those big people's hand. Ask what happened. How come? Say he doesn't know. He was kind of confused. I think I was thinking maybe it's this kind of thing might have push him or make him busy search. Don't know. I was like, wow, unbelievable. So when I was studying this, the story of the guy just come up in my mind. I say, wow, this can really be truth, you know?
Yeah. Well, it's really hard. Mental illness, mental
That
diseases
can just
are
be so
hard.
funny. Yeah.
Yeah, because you can't see it.
Yeah, well, and it's like there's so many factors with mental health that that's why, like, if you go to a doctor and say, like, they ask you so many questions because it's just so involved, and you like sit down with the counselor, you know, and the counselor is going to ask you all about your life from your very baby childhood, because so many things in your childhood can affect why you are a certain way, right?
Yeah.
And so, and a lot of these mental health diseases, they like are connected. So if you have bipolar disorder, you probably have like multiple other issues, like obviously depression, obviously like ADHD, because you're going like, you know, so they're just really, they're all like, they link, you know, in a lot of ways. Not all of them. Some can just have a mild depression and you know, that's it or whatever, but they are, all these symptoms can go to like almost all of them, but they are just, you have to group the symptoms and then figure out the diagnosis. So
you said it so perfect, Sarah. I actually have, my daughter has the one that is in the Marine, in the military. She's 21. And when she was in high school age, she was super advanced. Since she was little, she was always way ahead of all the other kids. Super smart. She was the one who they always ask her to do everything because she was always ready, super smart. And then around high school age, they noticed she had a little bit of ADHD. And then, like you said, it's related, it starts. And then she will go on highs and we never noticed. We were not educated. So she would go on highs and then she will be like, okay, I'm gonna go to musical school while she graduated high school early. And she was doing like 10 things at the same time. Like she was like, go, go, go. She will achieve so many things at such a young age. And then she went to the Marines. So once she went to boot camp, after boot camp, that's when they did a test on her because she started feeling, okay, why am I in this high? Why? And then I go low. That's when the military, that's when it pushed it to, okay, I have something. I need to figure out what I have. And she went through all of they did a lot of tests on her. And she has ADHD and she has a little bit of bipolar, they say. And that's why it makes sense why she always been so high for so long. And then she will go on her lows. So you, Sarah, described it so perfect. And she's so happy. She does a million things. She graduated from like, because she's a graphic designer for the Marine. She's doing nutrition school. She has like 4 or 5. Oh, she actually graduated from barber school. She's only 21. She graduated from different degrees and she's only 21.
See, and that like the ones like my friends that I know, family and friends, they are the same way where they are like super successful because when they get on the manic phase, they really, and it's not even when they're not manic, like their whole being, they are just super intelligent normally, and they put all their energy into something. And so like, and they normally are like really good person.
They're good with people. They have the people skills.
Yes, they are very like motivated and social, and people are drawn to them.
The whole world knows her.
They're
Yeah.
fun and exciting. And so
Yep.
in our books, it talks about how they love people, they talk to people, they're sociable, and people are drawn to them. And that is so true because they are so
Yes.
outgoing and they have so many awesome ideas that they want to share with people. So a bipolar person, you wouldn't expect it
Yeah.
because the symptoms are just like, this person's amazing, you know?
Yeah. Yeah.
So, and
So-
they obviously still are being diagnosed as bipolar, but they,
Oh, yeah.
like medication can help them.
Now
And
with medication is a big thing because they put her on medications a few months ago, and it's making a huge difference. At first she was a little tired and I'm like, oh, they took your superpower, cat. I would tell her because she was always so high.
yeah,
And I'm like, and I was a little bit afraid of the medication, but they're giving her like a very low dosage. And now she got married. She met a wonderful Marine. He just got baptized last night.
oh wow,
They're so cute together. And he's calming her. It's insane how much he's calming her down now. It's like
Yeah.
she's more okay. She's not like on her crazy go. She's more, I don't know if it's being with him and the medication is making it more like very stable.
right.
All right, that is very great. So who else remains to give us his case study? Stella, have you shared your case study with us?
No, let me do that right now.
So we have just a few minutes to conclude.
Okay, I'll hurry. I'm just going to read it. A patient goes to the doctor. She is a female that has been married for 10 years. She embarrassingly tells the doctor that she is having problems in her marriage, and most of it is because of physical intimacy. She has a low libido, doesn't enjoy sex with her husband, and is wondering if something is wrong.
Depression.
That could have been, not that one.
No?
That very well could be.
Yeah, you're tricky. You tricked us. Let me see.
Yeah.
Let me go look on the other ones.
Is it female sexual arousal disorder?
Yeah, it is.
What?
This is what?
So
What is
this,
it?
I know. This one I have like some issues with because I'm like, what? They're calling that a disorder? Because to me, this disorder stems a lot from my experience with like knowing a lot of women. Their problem stems from like religious belief or whatever, or what they've been taught, and then all of a sudden it's like, okay, but they still have this guilt and shame about it, and so they are not able to like orgasm or get into sexual intercourse because they just have this a mental block that they can't get rid of. And so, and then
they went through things in life and maybe that could be another sign.
Right. And then another one, and it kind of goes through that in the book a little bit, but the other one that is not mentioned in the book at all is that a lot of my friends that have had this issue is honestly because their husband doesn't care to that they are doing that or not. You know, it's all about the male. And it could be reversed, but I think that wasn't addressed at all in here, where it's like the woman can be diagnosed with having this issue that she's not orgasming, but really it's like her husband is not
taking that time. Right.
And so that kind of rubbed me wrong when I read this, because I was like, what? They're calling this a disease when it's not like, this isn't even our fault right here. This could be like so many factors, like the way that we've been taught, or, you know. So this was touchy to me, just because I'm like, wow, dang it. We were screwed from the beginning. But yeah,
I didn't know all of that until I got married, and my husband educated me on the women, you know, and all of that, because and he always made sure that he took the time that I was taking care of, and I didn't know things until I got married.
Yeah, I think it's very important to like talk about, because this I see this ruining so many marriages, because but a lot of it is just because like the woman doesn't know like her body and she has things about it, but then also the husband just like doesn't know and doesn't care and doesn't, you know, it's kind of just selfish. So this definitely I feel like is a disorder.
It's a big one.
In some ways that has like it can be solved like pretty easily. Without medication or anything. It's just like, I guess I think a big one for this is counseling.
Yeah, it's communicating.
Mm-hmm.
That is very, very counseling. Okay, Darlington will give us the diagnosis procedure. I am going to do the treatments. Darlington, are you there?
So the diagnostic procedure, you collect the sexual history and then you look for physiological as well as psychological sources. So you just take a history and then see, yeah, that's it.
You see what causes the pain. Maybe that's what you want to say. Okay, the treatment is a using of cream, water, sober or lubrication, hygiene, excision of scan, vaginal stretch, education about sexual response, and counseling. So in this kind of case, when I was young enough, when I get married new, it was like, I'm having such issue. It was like a big time problem. I was like, I will be dodging shots. When it comes to night period, my heart will be flying as if somebody will kill me today. I was in a serious pain. It was a very big deal to me, Sha. I was so scared of cells and all, you know, that kind of thing. Well, they're begging, no, I can take it, but where I was so scared, I was so afraid of it. And as time goes on, through the counseling and everything, I get to go use of it, then I get off it. So it's a
Did
very,
you
very
go
nice
to something traumatic in your life, in your childhood life, that made you very afraid?
No, I didn't do it, but the first day, because of the painful of the let's say the staging of the thing, I was so scared seeing the blood, and like I was like, wow, I'm not gonna do such a thing in my entire life again. In short, I was like so so embarrassed and so scared of it. So it was
Yeah,
a
it's
tough
okay.
of time.
Yeah.
That is it. And it's very good in a situation like this as a woman, they should start early to teach you one or two things about it so that you will not be scared. Had it been my mom teach me about it, maybe I won't be scared of it. I will know that it's something I will, you know, come across at the end of the day. Something like that.
Yeah, and I think it is generational. Like, I don't think a lot of our parents talked about it just because it was taboo, you know? Like, it's like, you know, special, sacred, that's all we're going to say and figure out the rest. But for me,
my mom would never have talked anything about sexual stuff.
No.
You cannot discuss it with her. I short, you will never, you will be just say, no, don't say something like that. It's not good, it's abominable, this. You will run into problems, something like that. But look at what happens to me now.
I know, we're paying for it, right? That's why, like, my children,
my heart will just fly off.
I am definitely educating my children and helping them out and making it like normal. Like,
normalizing a good thing.
Normalizing it is a good thing, but also you can still say that it's sacred, you know, say that, you know, like bring in the teachings that we were taught, but also don't make it so awkward and weird, because they're either going to be fearful and not know things that will help them when they're older, or they're going to be curious and they're going to figure it out at a young age on their own anyway.
It's
so
true.
It's just important.
I used to be more shy about talking about it with my kids, especially that I have 3 girls and 1 boy. And my husband went to, he studied psychology and he wants to be like a marriage counselor one day. And he's the one that taught me, no, it's okay to talk about it. It's okay. Our kids need to learn that it's good to want to have sex with your spouse. That's a good thing.
Yes, my sister actually is going to school to be a sex therapist.
Okay, yeah, good for her.
I mean, like because she's so passionate about it, where she's like, if I would have known, like if I would have been taught differently, things would be different. And I want to make a difference and help all these people that are messed up now in my generation. I need to help them. Oh, man.
I love
Right.
it.
Oh, this sounds like it's a ladies' topic.
Oh, that is
Sorry,
not-
Anthony and Darlington.
It's not a women's talk, you know. In general,
You guys have it easy, man.
I didn't even think we were going to talk about all of this today. I was like, I think we're going to skip these pages.
But I think in the announcements, one of the announcements or the syllabus, it did mention that some topics will have this kind of areas to discuss. So yeah.
But see, that's what I'm talking about, is that we go into it all nervous and scared about it, where
and it can be fun.
But yeah, like if we can just
we're going to discuss the one that is bigger and more than this. Maybe I think week 6 thereabout or week 7. Go and check it out. You will see what.
Yeah. So I just want to share something with you guys. Huh? So like I said.
Okay. Can I stop the recording?
Yeah, you can stop it.
I still had the question.
Okay. Go ahead and share.
You're mute.
Oh, okay. Since the following. For the past 2 weeks, she has been feeling sad and is having suicidal thoughts. Her concentration in her studies have decreased and she wants to quit school. She has been craving sweets, sleeping for more than 12 hours a day, and feels hopeless. So what could that be?
Depression.
Yeah. It was an easy one, this one.
Crave sweet.
Finally.
Yes, depression.
Sweet and sleep. That's like, okay, she's depressed.
Okay, so what are the diagnostic procedures and treatments? I don't know who's doing what. For it.
Diagnostic, I can do diagnostic. It says must have 5 of this for 2 weeks. Sad, anxious, or depressed mood, diminished pleasure in most activities, weight loss or weight gain, insomnia or excessive sleep, agitated or reduced physicomotor activity, fatigue, loss, energy, guilt, worthlessness, hopelessness, decreased concentration, thoughts of death or suicide, persistent physical symptoms that do not respond to treatment.
Yep.
Yeah, exactly.
And then the treatment, who wants to do the treatment?
Okay,
Treatment.
I mean.
Yeah, go ahead.
Oh, you can go ahead. Go ahead.
Me? Okay, so treatment of depression. I'm not looking at my book right now, so correct me if I'm wrong, but there's medication and then there's therapy, counseling, and like vitamin D, getting sun, and meditation. That's kind of stuff.
Yeah. Yeah, you nailed it.
All right, guys, sorry.
Yeah, so I'm done. I'm done now.
Perfect.
So who is going to do the treatment and who is going to do the...
We did it.
Okay, we did it.
We
Thank
got
you
it.
very, very... Thank
We
you
got
very,
you.
very much. without me. I'm sorry. I'm sorry.
No, you're great. You're great. We got it all handled.
All right. Thank you very much, everybody. I think we are going to end this meeting right now.